Hello to the International Headache Society community. I am here at the IHC Congress in Sao Paulo. My name is Francesca Puledda. I'm a neurologist and senior clinical lecturer at King's College London. And today I'm joined by Dr. Roberta Messina to talk about some research that she will be presenting at this conference. Hi, Roberta.
Hi, Francesca. Thanks. Hi, everyone. I'm Roberta Messina. I'm a headache specialist and assistant professor at Raffaele Hospital in Milan, Italy.
Wonderful. It's great to have you here. So, Roberta, I understand that tomorrow you'll be presenting one of your newest studies. Can you talk a little bit about this? I understand that it's about the glymphatic system in migraine.
Yeah, so we know that it's been a lot of discussion about the glymphatic system. It's a well-known network of perivascular spaces that aims to that is involved in the exchange of fluids and solutes from the brain. And there have been some contradictory results in the literature regarding the involvement of the glymphatic system in migraine. So there is actually contradictory results regarding a possible involvement in chronic migraine, because there are some studies showing an increase of a measure of the glymphatic function that is called DTI-APS index, while other study actually showed a decrease of this measure in patients with chronic migraine, while no evidence of alterations have been shown in patients with episodic migraine.
Okay, very interesting. So I imagine it's a neuroimaging study. What are the objectives of your paper?
Yes, so against the background that we have just said, in this study we aim to use two different imaging approaches. So we used one approach that is called diffusion tensor imaging along the perivascular space, that is a diffusion tensor imaging approaches that provide information regarding the so-called DTI-APS index. So the DTI-APS index is a measure that provides indirect information regarding the glymphatic function, provide information regarding the diffusion at the level of the perivascular space that are assessed close to the lateral ventricle. So what we wanted to do was to apply also another diffusion approaches that provide information regarding also the activity of the glymphatic function at the level of the interstitium. So we applied this other approach that is called NODI, provide information regarding the white matter intracellular and extracellular volume function, so having also information regarding the glymphatic activity at the level of the interstitium. So our aim was to use these two different imaging approaches to evaluate whether the lymphatic system is involved in migraine pathophysiology, and specifically to evaluate whether it could be involved in the acute headache phase, a mechanism of chronification of migraine with medication overuse.
Okay, so this is a very novel approach. I don't believe it's ever been used in migraine populations. So what are your results?
Yes, so I confirm this is the first study that is going to be used these two approaches. What we found actually interesting was that we did not find any significant differences in terms of the DTI-APS index. Specifically, we confirmed that there were no changes in patients with episodic migraine, neither when we used the NODI approaches. However, interestingly, even if we did not find any significant differences in terms of the DTI-APS index in patients with chronic migraine, when we applied the other DTI approaches, so the NODI approaches, we actually found that the patients with chronic migraine, compared to controls, they had a reduction of the extracellular volume fraction, which was associated with an expansion of the intracellular volume fraction, even if we did not find any significant differences between chronic and episodic migraine patients. And interestingly, we found similar results when we compared the patients who were having a migraine headache during the MRI compared to patients who were studied interictally. So we, similarly to what we found in chronic patients, we did not find any significant DTI-APS index differences. However, we found that patients who were studied during a migraine headache, they had a reduction in the extracellular volume fraction with concomitant expansion of the intracellular volume fraction compared to controls, as well as compared to patients who were studied interictally.
Oh, how interesting. So you were lucky enough in a way to see patients during an attack, and these were spontaneous attack. You didn't provoke them.
Yeah, indeed, they were spontaneous attack.
That's very interesting. So to conclude, what do you think is the take-home message of your study, and is there any translation into the clinical practice?
So we can conclude that actually the DTI APS index could be not like an excellent measure to investigate the glymphatic, the activity of the glymphatic system. So maybe we need also to combine and to use also other imaging approaches. So our study showed that that in our cohort there were no alteration in the DTI APS index. However, we actually found that the patients with chronic migraine had these, and as well as patients who were experiencing headache had this the decrease in the extracellular volume fraction and an expansion of the intracellular volume fraction. And interestingly, there is evidence showing that this reduction in the extracellular volume fraction with the expansion of the intracellular volume fraction could be an indirect measure and could express indirectly on an impairment of the glymphatic activity at the level of the interstitium. So we could hypothesize that in our cohort there's an impairment of the glymphatic activity in patients who are experiencing headache phase, so the acute migraine pain, and this could express or could suggest that actually an impairment of the glymphatic function could lead to more accumulation of neuropeptides and neurotransmitters that are involved in the acute headache phase, and this could be more pronounced. So in chronic patients that we know are experiencing more frequently headache episodes. So in the clinical activity or in the clinical settings, there's not like a direct implication, but
Not
for
yet.
sure, yeah. Maybe like better understanding of this mechanism could improve actually also our understanding of migraine pathophysiology, and who knows in the future
Maybe a
novel
biomarker
target. Yeah.
for the future. Okay, well, thank you very much, Roberta. This is incredibly interesting. If you would like to add any conclusion for our audience, please do.
Thank you, and thank you also for the opportunity to present our studies. So my conclusion is that maybe these could be novel findings regarding migraine pathophysiology, and that for sure in the future we will need new studies and further studies to confirm our findings. And also it would be interesting to see whether migraine preventive treatments could have an influence of the glymphatic activity in migraine patients.
Very good. Thank you.
Thank you.